we are going to get this belt on around you, so I will have you lean forward for me, please. Excellent. So with the belt, we are going to want to make sure that this is down kind of around lower part of her trunk. So it's around her chest, but we do want to make sure that the belt is going to be positioned above the G-tube, so it's not placed directly on there. So with this belt, you will want to pull the handle forward so you can start to slide the belt into here. And then I'm going to have you lean forward for me again, Meliss. And then when we put this on here, you are going to want the belt buckle, you could relax, to be positioned to the side so the belt buckle is not directly on the G-tube. And to do this, you can go ahead, and I like to lift Meliss's shirt up just to make sure it's in a good place. Is that okay, Meliss, if I just double check that? Yes, okay. So this is where I will say I will pull this up so we can see the belt is positioned above the G-tube. And then I like to put Melissa's shirt inside her pants then just to cover and protect that. Good. And then with this, I am going to tighten this one more time because you can see this belt is very loose where I could stick my whole hand in here. We would really want to, when it's tightened, just be able to have one finger in between the body and the belt. So could I have you lean forward one more time for me, please? Good. And I'm just going to tighten this. Good. And so now this way you can see only one finger is able to fit in between. Okay. And then with this extra part, you can just loop that in, just making sure it's not directly over the G-tube. Okay. So we're going to go ahead and now we're going to come over to the mat table. So could you lift your footrest up for me? Perfect. And I'm going to have you scooch forward, please. Okay. Very good. And I'll have you go ahead and you can lean forward. Excellent. So with the belt, I would recommend that you're going to put one hand on either side of the belt to be able to help hold. And Meliss will be able to use her right arm either on your arm or in between your arm and your body to be able to help stabilize. With this, she does not need to use her left arm to help hold on to anything, to help with minimizing stress on the neck and to help with pain. The left arm does not need to go anywhere in specific for the transfer. Okay, and with the transfer, I do like to make sure to always ask Meliss to lift her head up and show us that smile, which she's doing perfectly right now. Okay. Are you ready to stand? Okay, so we're gonna go ahead and do this on the count of 3, but I'd like you to lean forward a little bit for me. Good. So 1, 2, 3. Good. We're going to turn. Good. And then we'll go ahead and sit down. Good. So you can go ahead and you can stop the video.